Hello, family. Hello, hello. It's Dr. Kelly coming at you. How are you today? How's everybody doing? Hello, hello. It's Dr. Kelly. How are you? Hi, everybody. I just wanted to come on and talk to you a little bit about all this Dr. Kelly business that you're seeing all over your timeline. So, most of you know me as Kelly Randle. I am a board certified internal medicine physician currently working as a hospitalist. That's just fancy talk, meaning that I take care of patients in the hospital setting. Um, so I've been doing that now for 7 years. And I kind of got to a place where I just wanted a little bit more. I felt like I should be doing more. I didn't feel like I was operating fully in my purpose. And so last October, I prayed and said, God, I just need you to give me a strategy. How do I do this? What do you want me to do? And he woke me up from a dream, and I saw, scene by scene, what I should be doing. Saw myself speaking, saw myself teaching. And I've always had a passion for patient advocacy, for teaching patients how to take better care of themselves. With over the course of my career, I've just seen where our people just don't know what questions to ask. They don't know why they're taking what medications. They don't know, what was done at this hospital. Folks tend to hop around. They'll go get healthcare over here at Hospital A, then go over here and get care at Hospital B. So just all these things that complicate care and make it very difficult for patients to even know what's happening, what conditions they have. And so my mission is to educate patients how to advocate for themselves, particularly Black and Brown patients, because we have a tendency to get shortchanged, especially in healthcare. And there's several reasons for that. Systemic racism plays a role, unconscious bias plays a role in that, hospital and healthcare deserts in communities. So there's so many reasons and so much distrust that goes back into our history of being in this country. Hi guys, thanks for joining. Hey, thanks for tuning in. Hey Judy. And so my goal is to educate our people, is to equip them with the knowledge that I have from being on the other side. Hi, Spore. Hi, Alania. About that and about how that impacts their lives, right? And so that's one component of what I want to do. That's on the patient side. And then I also have goals and aspirations to educate healthcare providers, physicians, physicians assistants, whomever, nurse practitioners about unconscious bias. And unconscious bias is really what healthcare disparities are rooted in, because it takes a set of ideas about a group of people that may or may not even be true, that may not be founded, and you basically project those things onto folks. So you see a patient and, oh, she's not going to take her meds anyway, whatever, and you aren't necessarily providing the best care that you can. Um, because of those biases. And so I'm a firm believer in you cannot address what you don't acknowledge. And so sometimes you need somebody to kind of tap you on the shoulder and show you that, wait, you're not as objective as you think you are. So those are just a few of the things that I plan to address as Dr. Kelly, amongst other things. I can't tell you everything now, but that's a little bit about it. So last month I had the privilege to attend a medical conference, a virtual conference called Momentum in Medicine. And basically the premise of that was helping physicians to see their practices, their brands, their businesses differently. And so I joined Medical Mogul Academy, which is basically a year-long intensive business class or course for physicians. So all the things that we didn't learn in medical school, right? So how to start a business, how to brand and market yourself, all those types of things. So I am now a medical mogul, class of 2021. And so that's really important to me because, like I said, I feel very confident in my ability to take care of patients in the hospital setting, but it's not enough. It's not enough. And so while I plan to continue to do that, I also want to give back and give back in a different kind of a way and give information that the average person doesn't have access to. And even when you see doctors on TV, they're usually not talking to Black and Brown communities. They usually are not addressing the things that matter most to us. And they're not addressing the underlying issues that cause our behaviors or lack of compliance. None of those things are in their mental when they're addressing the public. And so being a Black physician, but then also having experience within different healthcare systems, and I get to see it all the time and know what that looks like, and have kind of identified some ways that I can help. And at the end of the day, want to just close those gaps, help get some equity in healthcare. So that's a little bit about my purpose and why you see Dr. Kelly all over the place, right? Um, the other thing is you see me doing a lot of COVID stuff. That came about kind of by accident. I really um, didn't intend to become a guru of sorts about it at all. I really just wanted to put out some truthful information and try to just help folks out because when we first started the pandemic, everything that was out there was, oh, melanin protects you. Black and brown folks can't get, coronavirus, and oh, it's just the elderly, and just all these misnomers. And clearly, all of those things are not true, right? So that's kind of where that was birthed from, and it's kind of taken off and become a thing all on its own. And so that's where that came from. And so every day now, I try to give something, whether it's mental health related, especially with the week we've had this week. We have had a hell of a week. I mean, there's just really no other way to say it. We have had a really, really, really rough week, and it only highlights disparities, right? It only deepens my purpose, deepens reason, my why, because it's just a lot being Black and brown in this country, and being judged and being shortchanged. And I mean, it just is a lot. It really is a lot. And so that's why my work is important. That's why I have to do the things that I'm doing, and why I'm so passionate about getting little pearls out there, that folks can pass on, because if just it helps one family, it was worth it. So that's just a little bit about what's going on with me. 2020 has been nuts, has been crazy, but it hasn't been all bad. Hasn't been all bad. Dr. Kelly came as a result of 2020, so we're gonna count that as a blessing. This is my first time actually going live, so thanks to you guys who are still here with me. Going live is not one of my things, or has not been in the past. And so this Medical Moguls Academy is stretching me in ways that I couldn't have even imagined a month ago. So here I am, Facebook living you, which is just blowing my mind, the fact that people are even watching at this point. Thank you so much. Thank you for all the love, all the support. I launched my Facebook page for Dr. Kelly a couple weeks ago. It hasn't even been a full month, and you guys have killed the game. Like, you guys are supporting like left, right, and center, and I appreciate it. I have over 500 likes, and over 100 of those came in the last like 2 days. So keep sharing, keep posting, keep liking. And I appreciate it in advance. I am on all social media. Another change that Medical Moguls Academy and another where they're stretching me, is I am on every single social media outlet, Facebook, Twitter, Instagram, Pinterest, you name it, I'm on there. TikTok, child, not TikTok a day in my life, but Dr. Kelly is on there. So more to come from me. Thank you for riding with me. Thank you for all of you who are praying for me, and for all of my colleagues. Thank you so much. And I will be back and talk to you soon. Enjoy your weekend. Thanks for watching.